February is almost here. It actually starts Saturday, but it's going to be American Heart Month. And the American Heart Association is going to host different events, of course, raising awareness. Nicole and Donna are here to tell us all about it and how we all could possibly save a life. I'm going to start, of course, with Nicole on the end here. So first, just tell us all about the different activities and how you all are planning to raise awareness about Heart Month.
Yeah, absolutely. Thanks so much for having us. And as you mentioned, February is Heart Month. It's all going to be about your heart health awareness. And we're going to kick that off on Friday, February 7th, not tomorrow, next Friday, with National Wear Red Day. So we encourage everyone in the community to put on their favorite red tie, red top, red hat, whatever it is. If your building can go red, let's go ahead and do that too. And really just call some attention to the fact that we should all step back and pay attention to our heart health. And if you do that, you can go on social media at AHA Louisiana and tag us, and we can pull together a reel of the whole city going red together. And also on Wear Red Day is our Go Red for Women luncheon. It's going to be at LaBerge. There's still a couple tickets available. You can grab those at heart.org/capital-area-go-red.
And tell us about how can people, I guess, get involved and, I guess, show support other than, I guess, wearing red. Are you all doing anything, I guess, on social media or any other type of campaign?
Yeah, absolutely. You can follow us on social at AHA Louisiana on all of the major social media platforms. You'll see tons of advocacy we'll be doing all month long, and then they are definitely invited to join us at the Go Red for Women luncheon on Friday, February 7th. Okay,
and of course we have these mannequins here because of course they're going to show us how we all should possibly do CPR and possibly save someone's life. So actually, Don, tell us, why is that, I guess, so important to actually know CPR, and especially, you know, I guess hands-only CPR?
Thanks. Yeah, thousands of people every year suffer from cardiac arrest, and 3/4 of those happen in the home. And many people are hesitant to start CPR because they aren't sure how to do it, or maybe worry about legal retributions if they're out in the public. So one of the most important things with CPR is circulation of the blood. When you have cardiac arrest, your heart has an electrical malfunction and it fails to pump the blood throughout your body. So hitting CPR very quickly can help circulate the blood in the body, the remaining oxygen, until EMS gets there, first responders, to give that higher level of care. So really focusing this year on teaching, encouraging as many people as possible to learn CPR to potentially help save even your own loved one.
First, lay them on the ground, right?
Sure. So what you're looking for with hands-only CPR, as you know, traditional CPR very quickly is breathing, compressions, you're looking for choking. This simplifies it a lot. So this can be used on teens and adults. This isn't something you would do for babies. If you see a teenager or an adult suddenly drop to the ground and they're unresponsive, this is when hands-only CPR is appropriate. Have someone call 911 immediately, or call 911 yourself. Put your phone right beside you on speaker so they can kind of talk you through it. And the first thing you're going to do, the person is long ways, you put the heel of your hand in the center of their chest and you're going to cover with this hand. Now, just know if you're doing this, you're going to be over, the person's on the ground and you're going to be directly over them. You want to not be at an angle. So this is actually a little high, but for our purposes, it's fine. So it's 100 beats a minute to 120 beats a minute. So you're going to go hard and fast. So, and you're not going to worry about breaths. You're just going to do compressions.
And then how long should we do this, I guess, until consciousness?
Well, if they're conscious, you're going to stop, but until advanced providers arrive. Now, it can be exhausting if you're doing this for a long period of time. So obviously, you do it until you can't do it anymore, or ideally until first responders get there. Funny facts, there is actually a Spotify, it's a Spotify playlist.
There's a Don't Drop the Beat Spotify playlist. It's all the songs that are perfect to keep the rhythm for CPR. It has Staying Alive on it.
I remember that.
Yeah,
Staying alive.
Well, because getting the heart to beat fast enough is very important. You want to do at least 100 beats a minute, and it's hard to count that when you're trying to do compression. So doing your compressions to the beat of the music keeps you on the right rhythm.